More tips for talking to a psychologist now, not a psychiatrist. Psychologists deals with behavior, and they know you and monitor. Now, a forensic psychologist deals with criminal behavior. You have to know the difference. They see the difference between someone who's never been to jail, a psychologist like a mental health psychologist or a children's psychologist. They go and have reports made over the years, little sections, this much on a piece of paper per admission or something before you got arrested, and that's the physician's note or the psychologist's note if you went to have like a test done. And the forensic psychologist then picks all that up, has your first meeting with you. What's your first meeting like? Yeah, shitty, eh? Y'all remember that. It was shitty. They said ew, right? And we picked our nose and ate it. Yeah. And then we said, okay, I won't do that. And then they say, well, you can pick your nose, but... And then we're like, okay, when we keep picking our nose, when we were going to stop if they didn't say that, right? So, that is set aside. You must keep what they deal with in their meetings to pass, right? To get a pass, to get out of hospital. Not just get out of hospital. If they just think, okay, well, they're not a risk for this, they're one of those patients, they're just going to get out of hospital. They're not getting absolute discharge. If you want absolute discharge, you have to prove that you understood what all that was for. So you don't have to talk to them very often. Like, you took DBT, dialectical behavior therapy. Well, you read, this is what you have to say to them if you pass, and never have to deal with it again. But you have to keep that behavior straight for the whole time until it's time to get out. Or they'll come harassing you, say you're not using your skills, right? The basics. What were the skills they taught you? The skills you said you could use in that group. Build upon them with yourself. When you go back to the psychologist, they'll say, when you go back to the psychologist, they will say, and that was the nurse manager just walking by, yeah, he's listening. How do you apply the skills? Do you have your own skills? They won't say, do you have your own skills? They want to say if you're working with their skills. But if you just come up and say, I use your skill, but I found that I use this kind of broader technique based on that skill. Don't say you stole it from, because they stole it from Tantric Buddhism. Don't say you stole it from Tantric Buddhism. Don't tell them that they're all stupid, they steal it from Buddhism, right? And all that other nonsense, right? It's not nonsense, they're nonsense, but don't tell them that. Tell them you use their skill and use their word for it. And if it works, say, I use it a little bit differently. I found out how to apply discipline. If you say the word discipline, that's what they're looking for. Can you show that you can compel the discipline? Can you clean even if you're not stoned, right? What if you can prove marijuana helps you with your actual diagnosis? That's probably the best thing. Not just that you didn't freak out and you didn't breach your disposition, right? Social workers are still there with those people, right? Unless they don't have their housing. Psychiatrists, what am I going to say to him? Because he's going to blast it up. He's trying to... He wants to say, I know what he wants to say. Well, you got beat up pretty hard there, didn't you? Because he wants me to feel like he has me in his grasp, right? That he can sympathize with me. No, sir, that's not what's making me angry at all, and you know it. Right? Just say something stupid like that to get at him. Because I don't really give a fuck, right? Peace out. Happy October 1st, everyone. Hell, Mephistopheles rise.